Sunshine, you temptress. My hands are in scaffold.
The gardeners have planted white roses when I specifically asked for red.
You could always paint the roses red.
What an odd thing to say.
More than 60 million women in this country are living with some form of heart disease. It is the leading cause of death among women in the U.S., killing more than 300,000 every single year. Yet only about half of the women in the United States are even aware of the risks. CBS News chief medical correspondent Dr. Jon LaPook joins us. Good morning. I think it's important to note, as you did before we started talking on air, the rates have decreased over the last 20 years, but yet and still, a lot of women are dying from heart disease. Why is that?
Yeah, well, I think it's a dangerous misconception that heart disease is somehow exclusively a male disease, right? Pointed out it's the #1 killer in women. There's a reason why we're wearing red today, and that's to bring attention to this, because attention and understanding translates to save lives.
Yeah. And when you think about the information that you have, we know some of the risks involved, you know, whether you're overweight, if you have diabetes. Can you talk about that, but also explain why so many women are dying of heart disease?
Well, you know, the risk factors we've been all talking about, and you can't talk about them enough because intervening, as you said, has led to a decrease in mortality from heart disease. But, you know, we have to keep remembering the numbers. So what's your blood pressure? High blood pressure, diabetes, high cholesterol, obesity, inactivity. And access to care is another thing where, you know, you have to be able to actually see a doctor, right? So a clinician.
Is there a certain screening women should ask for specifically or at a certain age? You know, because we talk about mammograms and knowing that after, you know, 35, 40 years old, you need to start checking. But what can I do personally to make sure that my heart is in good shape?
I love that you bring that up because it's not something where you want to wait until you have symptoms and then say, okay, now I'm going to really, you know, get into it. This should be a lifelong thing. So from birth, you want to have healthy habits, right? You want to try to be the right weight. As you start to be seen by clinicians, you want to know what your numbers are. You want to make sure your blood pressure, because, you know, high blood pressure is silent very often. So you want to know those numbers. You want to make sure you're not diabetic. You want to make sure your lipids are okay. There are things you can do.
And you mentioned birth. What about heart-related complications during pregnancy? What can women do?
Well, pregnancy is a big stress test, right?
You're right.
I mean, you know, you wouldn't run a marathon and say, you know, like the day before, all right, I'm going to start training now. So you want to go in there with good health, and you know, part of that means again access to care, making sure that you know your numbers, that you're the right weight. You know, this has been a problem, and especially as you know, there's a increased mortality during pregnancy in black women, and it's a problem that's been addressed, you know, but sporadically and not well enough. And the reasons for it are multifactorial. It's social determinants of health. You know, if you don't have access to good housing and good food and access to care, and then on top of that, of course, we know there's implicit bias, and these all combine to increase mortality for black women.
So, I mean, let's encourage people to take action here, right? Get involved. You can lower your risk, and one of the ways is to get active. A lot of people say, I don't have time, I don't have the money, I don't have the resources, whatever. What's a tip to get people off the couch and out there?
So here's my tip. Like, people don't like to tell my patients, as you know, I do internal medicine, NGI. Who wants to go to a gym? Okay, there are people who like to do that. But why don't you sort of have a hack to do exercise? So if you're commuting to work, how about commuting 10 blocks before work and then walk? If you're taking the elevator to the 22nd floor, take it 7 floors under that and walk.
Okay, a little hack.
So make it so that you're not saying, okay, now I have to do exercise. Exercise just part and parcel of just how you live your life.
Really quickly, what should people know if they hear like fatigue, or what is a sign?
Okay, so, you know, in women still, you know, most common cause of a heart attack in terms of symptom, you have chest pain and shortness of breath. However, there are some more atypical symptoms like nausea and vomiting and fatigue and maybe radiation of pain to your jaw or your back or some other area.
I had a grandmother who used to walk for heart health, but would smoke a cigarette while doing so.
Stop smoking! Thank you for reminding me that. No smoking.
No smoking. She's no longer with us a long time ago.
It's one of the big reasons for the drop is the decline in smoking and control of all these risk factors.
She was enjoying her life, though. Dr. Jon LaPook, thank you very much.
You can drive all night looking for the answer.
This is so sick and fucking twisted! Sick and twisted! I'm dying. I mean, we're all dying, but I have the unique privilege of knowing what's gonna kill me if something doesn't get me first. I have hypertrophic cardiomyopathy, which I was diagnosed with after my brother went to baseball practice one day and didn't come home because he had a sudden fatal cardiac event. At the age of 14, in the haze of grief, I had to navigate a new world that no longer had my little brother in it, but also I had to have a defibrillator placed, and I had to comprehend a disease that would eventually kill me. Naturally, my adolescent brain couldn't fully comprehend what this disease was to me and my life. I had a defibrillator placed and I was good. It would either go off or it wouldn't. Every year I would go to U of M and have my heart appointments, have my echocardiograms, my EKGs. Sometimes I would have stress tests, and I didn't show any signs of progression, so it was a non-issue to me. My health priorities were the migraines with aura that I started having in high school, and then it became the anxiety and depression that I was experiencing in college. And then in 2020, I started experiencing excruciating, debilitating pain that ended up being endometriosis. Endo really became the center of my world. My life revolved around when I was in pain and how I could manage that pain. I missed out on Christmases and precious family time and work and just everyday ordinary things because I was in such debilitating pain multiple times a month. My experience getting treatment was super traumatic, like I know it is for a lot of women. I would be crying in doctors' offices to doctors that just would not hear me, would not understand the amount of pain that I was in, and it was really, really hard, and I kind of had to take my health into my own hands. This is when I became diligent about what I was consuming and putting on my body. I cut out gluten and dairy and excessive amounts of caffeine and fragrance. I found comfort in what I can control and the improvements that I saw. Then another yearly appointment with my heart doctor came around, and it was different. It was the first appointment that I showed disease progression and I failed my stress test. But also at this appointment, she gave me a referral to a pelvic pain specialist at U of M. Even though for the first time in my life I showed progression in my heart disease, I was still focused on my endometriosis, and it became clear that I was going to have surgery to remove a endometrioma that was the size of an orange out of my abdomen. By the time that my next heart appointment came around, my surgery was set for February. But again, this appointment was different. My echo showed further thickening in my heart wall that is building pressure on the inside of my heart, and my body essentially can't process salt normally. All this to say that I really can't ignore my heart health anymore, and so that's what I'm going to make silly little videos about. What I eat and how I manage my stress and how I live as a 27-year-old in the beginning stages of congestive heart failure.
You just call on me, sister, when you need a friend. We all need somebody to lean.
February is Heart Health Month, and this is just a reminder that heart issues don't only affect older people. I was diagnosed with a form of SVT called atrial tachycardia in my 20s. It's a heart arrhythmia where your heart beats super fast even at rest. It could go upwards of 200 beats or more per minute. It was dismissed as stress and anxiety, two factors that could definitely make it worse, but were not the root cause of the issue. I continued to advocate for myself, and eventually I had a heart ablation. Different forms of SVT are often overlooked or dismissed as something much less than what they actually are. Heart health is an important factor for everyone's health. If something feels off, go check it out. Don't ignore it, push for answers, because your symptoms are real. Everything you do flows from your heart, so it's important to take care of it.
I got my sights set on you, and I'm ready to aim. The last time I freaked out, I just kept looking down. I just stuttered when you asked me what I'm thinking about.
all you know. When thought is not below us, no can go up, and that iron ground. Clear, all too soft for sound. Bed is hardly shown. Scraped across the phone. Like they stole it, and oh, how they hold it. Claire, we nearly forfeit.